So you're flooded with fertility advice online and you don't know who to believe. Some information can help, but some can actually hurt. But how will you know? So today I'm going to introduce you to somebody who can help you. He's the president of the technology department for the American Society for Reproductive Medicine, and he's going to help us understand fact from fiction, what helps and what doesn't help, and what you need to know so that you could advocate for yourself. Pull up a chair. I think you're going to find this episode really helpful. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schumann, author, researcher, and reproductive medicine therapist. Welcome to today's episode. I have a very special guest for you. He is the president of the American Society for Reproductive Medicine's Tech Group, and this is such an important role, particularly now when we have so much misinformation out there on social media and all over the internet, and it's really important to know who you can trust and who you can't trust. So I'm going to introduce you to Dr. Ku, but first I just want to tell you that not only is he a reproductive endocrinologist and he's won many, many awards, but he was also a fertility patient himself, so he really understands your difficulties, understands your pain, and understands how important it really is for you to know who you can trust, who you can't trust, and what you need to look for when you're getting information online or from your doctor. So thank you so much, Dr. Ku, for coming.
Thank you so much, Lisa, for having me. It's a complete honor and thrill for me to be here. I'm excited to be able to talk about our subject today, and I'm just so excited. So thank you so much for the invitation.
Oh, it's great to have you here. And since you're leading the charge at the American Society for Reproductive Medicine, I really think it's so valuable for people to hear from you because this is something that everyone has to understand. And we are really, and many people don't know this out there, but we are really dependent on the American Society for Reproductive Medicine to help not only educate us, but also develop guidelines that are really important and help our industry really regulate itself. And that's so important. And we're going to talk about that a little bit today, too. But first, I'd like to just say, Dr. Ku, that one of the things that is really a thorn in my side is that I go on social media and there's so much misinformation out there. People are really preying on people who are so vulnerable. People are saying, well, if you eat 4 pineapples or you do this yoga pose or you do something else, you're going to get pregnant easily. And I think it puts a lot of pressure on patients who not only feel responsible anyway, but also don't have a lot of time to waste.
I totally agree. If I could just kind of just pause for a moment and just say, I remember when my wife and I were trying to conceive and we were struggling and it wasn't working naturally for us. And so we didn't know where to turn, right? We weren't sure who to ask. We were kind of ashamed that we couldn't conceive and we weren't wanting to really publicize it. So we didn't want to ask our friends. And so it was really difficult. So we turned to the internet. And so what we did was we basically looked on them online. And this was back 15 years ago. And we just Googled and we tried to find as much information as we could because we wanted to have that dream of the baby and our family. And that dream was fading away. And so we were desperate to look online to see if there's anything we could do, anything we could try in our own lives and our lifestyle to try to improve the odds. So I get it that when patients are struggling to conceive and they want to get pregnant very badly, as we all do, that they will want to turn to the internet for easy access for information. And so what's nice is these days there is a loud voice and a very large community to embrace couples who are struggling to conceive. I remember when my wife and I were trying, there really wasn't that big of a community. And it was a little bit shameful at that time. We were worried that it was just taboo sort of subject to discuss. So it was a very small voice at that time. And so now, thank goodness, there is a larger voice. But you're right. How can someone who doesn't have a health background or a medical background wade through and decipher what is legit information and what is just fake news, essentially? That's a waste of time and waste of money. And it could be even harmful to you. So it's really hard to decipher that. And so I agree with you that I'm so glad that we're talking about it today. How can we help patients and future patients and potential patients even understand what's real and what's not real online. I think that's really important.
Yes, so important. And so important for every patient to know what's right for them, also, right? We have so many different patients that we see now that we didn't see 30 years ago when I started, right? The single parents and gay couples and people who are co parenting. And everyone needs the same information, right? None of us really understand reproduction the way we did in 10th grade in our biology class anyway, right? And we certainly don't know the technology. So, how do people start? What would you recommend?
So, the internet is a wealth of information. There is legitimate information out there. But there's, like I was saying, and like you were saying, there's also a wealth of unfortunate misinformation. So, one of the things that I would recommend is first, you can start to Google if you'd like. First, go online, you can Google, or you can go to Chat GPT. Now, we have to remember, be careful about artificial intelligence these days. It's still not perfect, but there is
Yes.
information on there. So, I think a simple Google search looking for infertility subjects like how do I get pregnant or I'm having difficulty conceiving. Now, once you get that search result, this is where it's very important to be able to decipher what site is legit and what isn't. So, my recommendation is first, trust the national organizations that are proven to have a track record of success. For example, the American Society for Reproductive Medicine, we call it ASRM. It's a national society that absolutely governs. It's an organization that governs what infertility doctors do, how they practice, and it will definitely contain very legitimate information. That's the first thing. Now, another site you can trust is the Society for Reproductive Endocrinology and Infertility, also known as the SREI. So, SREI actually has a very special website dedicated to patients called Reproductive Facts, I believe is what it's called. And so you can look at that website, and it's based and written for patients. And it's written in very easy, normal language so that we can all understand it. And there's a search function, and there are plenty of topics that you can search for, such as PCOS, male infertility. So there's all sorts of things you can look for that are very, very high quality information that is very, very much proven in science and is very legit and is very trustworthy. Another site is the Society for Assisted Reproductive Technologies. That's called SART, a very good site. And also, you can even go look at the American Board of OBGYN, also known as ABOG. So that's where I would start. And then next is when you get that list of the search results, then start looking for sites that also are written by and published by people or practitioners who have a license. It's so important to trust information from licensed professionals rather than,
Yes.
say, like influencers who might have an idea of the treatment, whatever is available treatment wise out there, but may not fully understand the science to the point where there could be some information given. So first, the national organizations. Number two is trusted sites that are published by licensed professionals.
Yes, that's so helpful. It's so helpful. And I think it's difficult because we have people who are like, coaches or people who are influencers who are talking about their experience. And that's fine if you want support. But if you want actual hard information or guidance from someone who's been in the field a long time and has seen things, it's really important to go to somebody who's licensed and has experience, right?
Exactly right. Infertility doctors such as myself, we go through 16 plus years of training and education and testing to make sure we know what we're doing and talking about.
Mhm.
So we absolutely are capable and ready and available to take care of patients. And when it comes to influencers, there's nothing wrong with listening to an influencer. They have expertise in their experience. But remember, everybody's experience can be different because everybody's fertility or infertility diagnosis is different. So just because one influencer had success with this doesn't mean that you will have that same success. Your case is
Yes.
very specialized and personalized to you.
Yes, I'm so glad you said that because I think it's so difficult for people to not assume, well, I did this thing. And so if I do that thing, I'm going to get pregnant too. Or maybe people don't talk about it, right? If someone is using, let's say, donor eggs, they may not be telling everyone. And so if you go to the same doctor who got them pregnant at 50 on the first try, you may not be able to get pregnant on the first try with that same doctor.
That's exactly right. The influencer may not be giving you all the information, so you may not realize that there is something else that occurred that assisted that person that wasn't discussed in the I guess in the post. So
Mhm.
so very, very important to know that. Another thing is that some people online will post that they got pregnant using a certain product, but it's possible and more than likely that they just conceived naturally by chance, and they so happened to have
Yes.
using or taking a product that probably had no bearing on them conceiving. So it's very important to understand that. And a licensed professional, such as a physician who's a fertility specialist, can absolutely tell you and distinguish what really can work and what was just sort of coincidental.
I'm so glad you said that because sometimes people say, well, I went on vacation, I got pregnant. Well, maybe they're just having more sex because they're on vacation, right? We don't know what the truth is.
Exactly right.
Hmm.
When my wife and I, when we started to conceive and we were struggling, we had friends who were very well meaning. They were being helpful. They were trying to help us say, hey, you know what? Just go get drunk or go hang out in the back seat of your car. Jokingly they said that because that worked for them and worked for other people. But in reality, people realize like that's not going to really help. It's really sometimes it just so happens that you conceive, but you happen to be in the back of the car that time or
Yes.
something like that. So that's where I was talking about. Well, sometimes it's coincidence. There is an association rather than causation.
So, speaking of this idea about how we can decipher whether or not people are telling us things that really make sense, how do we also know that they're not investing in this product in some way? Because sometimes people have investments in products, or there's some incentive for them to say, yes, use this thing, or use my yoga pose with my videotapes, and therefore you will get pregnant.
That's a very good question. I would tell patients, number one, trust your gut. Probably sometimes if it sounds too good to be true, it definitely probably is too good to be true. Number one. Number two is definitely unfortunately, this requires a little bit more of investigative work where you have to see like, well, is this person saying that this product worked for them? But is it because they also have an invested interest? Do they own share stocks? Did they make this product? You have to be very careful about that. And unfortunately, it is hard to figure that out. So you have to do a little bit more digging to figure that out. Now, of course, if someone has a vested interest in a product and then they're telling you that's what you should do, I would say it's probably too good to be true. I would not trust that. And I tell patients there are a lot of people out there, unfortunately, who are trying to take advantage of desperate patients who all
Yes.
they want is a beautiful baby, a beautiful family, and they're willing to do anything to get that, and they don't realize that they may be taken advantage of by purchasing a product that has no improvement in the fertility. I'll give you another example. It's prenatal vitamins. Prenatal vitamins, that space is huge. It's a big market. There are some good prenatal vitamins that are very good and healthy for patients. And there are some that are marketed as really helping with fertility. And the truth is that most prenatal vitamins are pretty much the same. And as long as you take a regular one with enough folic acid in it and eat a healthy diet and remain healthy and fit, it's truly all you need. And I have patients who come in with bags of bottles of supplements and they show them to me and they spent hundreds, if not thousands of dollars a month on these products. And I can show them that okay, this one, you don't need to take this one. This one's not been proven. In fact, most of the bottles that they bring in have not been proven to be a benefit. So I just don't want patients to waste their time or their money.
And they could actually hurt you, right? I mean, there's some that could be hurtful.
You're exactly right. The tablets that are in these bottles that are sold over the counter are not FDA regulated, which means that they can actually be filled with anything. And what I tell patients that I say is they can be filled with sawdust. And the
Mm.
bottle can say miracle pill to make a baby, and they legally can sell it. And so you have to be very careful. Additionally, the FDA actually performed a study many years ago where they actually went to like a herbal market and they grabbed all these bottles of medications or supplements rather, and they tested every single tablet to see if it had number one, the actual ingredient in it. Number two, the stated dosage. So if the bottle said 10 milligrams of such product, it should have 10 milligrams. And what they found was that not all the tablets and capsules contained the ingredient. Number two is if they contain the ingredient, the amount of ingredient ranged from 0% to thousands of percent. And so, since there's no
Wow.
regulation, you could be taking tablets and supplements that could be harmful because you're taking too much, or you could be wasting your time and money when it has maybe nothing in these capsules. So, you have to be very careful about that.
That's so helpful. I really appreciate that. Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert-guided platform designed for parents and parents-to-be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. And what about when it comes to treatment? So there's a lot of information online now about different types of treatments and how people should be looking at reproductive medicine, kind of on both ends, right? The super duper, do everything under the sun, and then, take the low tech approach. What are your thoughts about all of this information that's out there?
I agree. There's low tech, there's high tech, there's the extreme, the both extremes. And so, one thing I worry about is that patients might spend too much time or lose time or waste time trying conservative options when they should be considering more advanced options. And so, what I worry is that in the fertility space, as you know, women are born with all the eggs they're going to have. And as time passes, the egg basket, so to speak, depletes. And once the egg basket is empty, that's considered menopause. And so, we worry that if patients are now losing eggs every day, every month, and they're spending their time trying a method that is too conservative and doesn't have a chance to work or has a low chance of working, that their fertility will suffer by the time they get to a fertility specialist who can try the advanced techniques on the patient. So I am concerned that this sort of push for more conservative treatments, though it sounds very good and it makes logical sense, but the science just says, look, we don't want to waste too much time. And there's nothing wrong with trying it for a short amount of time. Just don't lose time, don't waste time, such that it'll be detrimental to your fertility overall.
Yes, I agree with that 100%. And it's so difficult because so many of the people that I see feel so emotional and they feel like just being able to go through an IUI is just over their heads. So IVF is taking out the big guns. They can't imagine doing it. And yet, the truth is, if they want to have a baby and that's what their doctor is recommending, it probably makes sense, even though it's really difficult to do. And that's why I think it's really important for them to work with a licensed therapist who understands reproductive medicine to help them get to a place where they can manage their stress so they can actually get to their dream.
Absolutely right. I'll give you an example. A personal example is my wife and I, when we were trying to conceive, we spent an enormous amount of time trying to control for everything we could control for, and it still didn't work. And we spent 3 years using
Oh,
conservative methods. And while that was happening, my wife's fertility level was dropping over time. And by the time we saw our doctor, our fertility doctor, it wasn't that it was too late, but it just made it harder for success. So it made it such that now we had no option but to try the more advanced and more technically advanced and more expensive, unfortunately, treatments like IVF to have children.
Yeah. Well, thank you for sharing that. I really appreciate it. I think it's helpful for people to know that you understand what they've gone through and that you're really in their corner. I think patients feel so disconnected from the treatment, from their doctors, and there's so much misinformation. It's really hard for them to be able to say, okay, I'm putting my faith in this doctor who's going to do the right thing for me. And I think it's really important that they understand that this is what you're here for. This is what you're doing. This is what you're made to do, to help these people have a family.
Yeah, no, thank you for saying that. I do tell patients, I say, I use that sort of pain that my wife and I struggled with, endured during our journey as a source of fuel to work harder for the patients, to let them and educate them so they understand and let them realize, like, okay, here are the options. Here's what I recommend. Let's go for it. And I always tell patients that and I see that when they arrive, they feel like it's game over. And I tell patients, it's not game over, it's game on. We are now just getting started. We are going to get going right now.
That's great. That's great. And I wanted to also ask you, which is so much more complicated in a lot of ways, about third party reproduction, because as you just mentioned, the SAR report is great and it's wonderful for all of you out there who are not familiar with it. If you have a doctor who is legitimately practicing reproductive endocrinology, chances are you will see them on this list, right? And it's great because you can say, okay, there's my doctor. I know this is a good doctor. He's doing the right things. He's checking the boxes. He's following the guidelines. And if you're pursuing third party reproduction, there's no such thing. There's no way to find out which surrogacy agency or which sperm bank or which egg bank is the right one. And people feel really lost.
You're exactly right. There is so much information available for couples who want to use their own eggs, and there's a lot of guidance for that. You're exactly right, and there isn't a lot of guidance, just like you were saying, for the third party. And you're right. Patients are very confused when they come to see us when they're looking for guidance on third party reproduction. It's so difficult sometimes for patients to make that decision. I know it's a hard decision to make, but when they're ready for it, we want to give them all the information they can so that it's easier for them to digest and understand. And what we have at our fertility center, Dallas IVF here in Dallas, is that we have a whole department that's dedicated to third party reproduction. In fact, we have two coordinators that work diligently with all of our
Mm.
patients who are wanting to pursue third party reproduction. So what I do is I have them meet with my department, and then and oh, I love my coordinators. They are awesome. Their names are Tammy and Rebecca, actually, so they're great. And they will spend so much time explaining and re explaining if they need to and answering questions for those patients because it is a long journey and it's a different journey to travel on for third party reproduction. But we're here for it. We are here to help.
That's great. So, your advice really is when you're going online, it's really important again to look to the professionals for advice there because that you can't really navigate on your own, unfortunately.
You're right. I agree. Unfortunately, there isn't a lot of self research on that subject. So trust your licensed professional. They can absolutely guide you the right way.
Yes, it's so important. And certainly for people who are not in a heterosexual relationship, this is where they're going first, right? They are going to look for the sperm bank or looking for a donor and looking for a surrogate. And right away, they know that this is what they're up against. And so it's really important for them to have a doctor who has a good third party department who knows how this works, particularly now because we're in a world where it's a little bit confusing where you can go, what states you can use a surrogate in. Are there going to be restrictions for her or what's going to happen? So it's hard to know.
It is hard to navigate, but you're right. The licensed professional and your doctor can help you. I saw actually quite a few patients this morning who were same sex couples and they were wanting to conceive using donor sperm. And they had done a little cursory Google search on sperm banks, and so many came up, and they didn't understand, like, well, what's the differences? Where do I
Mhm.
start? How do I look for what am I looking for? They ask how many vials, and when do I ship? Do I ship it to the office? And so these are questions that are legitimate, and
Yes.
unfortunately, the answers just aren't on the internet. That's why I was so excited to be able to explain to them, like, Okay, let's talk about these different types of sperm banks. Make sure that they're FDA approved, and also make sure you look at the sperm banks that have a lot of options, so that you can see that there you might find the type of sperm donor that you're looking for. Also, make sure that you look at the sperm donor. Make sure that check out their CMV status, check out their carrier screen status, and what they're carrying mutation wise, recessive mutation wise. And we talked about how it's important to make sure we don't have matching mutations. We talked about what CMV is. So, yeah, your licensed professional, your doctor will absolutely be able to help you with all of this. And yeah, we're here. We're here to guide you.
And that's really so important because I think when you're thinking about, I need sperm or I need an egg, that's really your focus, right? You're not really thinking about, well, is this sperm bank going to be a legitimate sperm bank? Is my best friend from college really the right person to be my sperm donor, right? And do I have blocked tubes anyway, right? Or what else is going on?
You're exactly right. Some couples come in wanting to use their friend's sperm, and understandably, your friend is a good person and they want to pass on this friend's genetics. And so it makes good sense. A lot of times, these couples don't realize that unfortunately we have to quarantine the sperm. And quarantining essentially is where we have to freeze the sperm and check the sperm donor's ID panel or infectious disease panel for any infectious diseases. And then 6 months later, we recheck the infectious disease panel. If it's still negative, then that sperm for the 6 months ago is now cleared for usage. And so some couples come in and they're like, oh, it's a 6 month delay. And that might change their mind sometimes.
Yeah, yeah, it could be make all the world of difference for sure. And when people are in these situations where they're looking for this information online, I know that, ASRM has established these guidelines about physicians and what they really should be doing and how to be careful online with patients and be able to help people without kind of giving medical advice, which is kind of a tricky thing to do, right? It's almost impossible. But how do people know, well, this person is really going to help me? Because, if you're starting down this path and you don't know where to go, and maybe you do a little Google search, and unfortunately, you're right, AI is not always correct. I went into ChatGPT and put my book in there, and it produced the wrong publishing house.
Oh my
So,
goodness.
yes, I can't even do my bibliographies for my presentations on there. So, unfortunately, there can be misinformation there too. So, how do people know? I'm going on Google, I see a list of people, or I go on Instagram and I see people. How do I know which person I should be listening to?
Very good question. So, first, I would recommend that make sure the person has a license or a degree. So, if they have MD, DO, or any other sort of licensing sort of initials after the name, that's the first thing to look for, and make sure that they have a degree and a license. And so that will at least give you some peace of mind, thinking like, okay, they have training, they've studied, they've probably been undergoing tests to make sure that they know what they're talking about. So that's the first one. The second thing is that unfortunately, licensed professionals, it's difficult for us to be able to offer personalized medical advice because we don't really know the patient very well, and we're
Right.
worried we might make a mistake. And so, what we'd like to do is get to know the patient a lot better. So, I request that the patient come and see me, or we can schedule a telemedicine if they live far away. And typically, I'll get to know the patient, and that's when I'm more than happy to give 110% of the personalized medical advice. But online, we try to give just more general advice.
So if someone goes online and they see one doctor says, I think this is really the thing to do, and some other doctor says, I think this is the thing to do, how does a patient know what to do then?
It's very confusing, right? When one doctor who's licensed and another doctor who's licensed, and they say differing opinions. And the truth is that there's 1,000 ways to skin a cat. And so there are many options that can be utilized to get to the same point, which is a beautiful baby, a growing family. So they both may be right. So be careful, though. However, sometimes one doctor might have a vested interest in a product, and you have to be very careful about that. Or one doctor might make more money from a type of procedure than
Mm.
other doctors. So you have to be very careful about that too. What I would suggest is that, and this may be more difficult, is you kind of have to look at the doctors as a whole. like. Just you look at 2 doctors, they have different. But if now you look at 100 doctors, which I do realize is difficult to do that online, and then you realize, 98 of them say this and only 2 say something different. Now you start to realize that, okay, the general consensus is that, okay, these 98 doctors, this is probably what generally is accepted.
And so the other one's just the outlier, and that's not the one that you want to listen to.
Right. So it's when you
Mhm.
zoom in and you only see 2 doctors, it's hard to make that decision. So when we zoom out, which I understand online, who wants to Google 100 doctors? I get it, and
Mhm.
ask their advice. But you'll start to see that there is a pattern like, these 98 out of 100 doctors have said this thing, and those 2 doctors or 1 doctor said something different. Those are probably outliers that are probably doing something different. Because I tell patients, because they come to me and they say, well, what about this procedure I heard online? It really improves my fertility. For example, patients who have diminished ovarian reserve. It's very sad. Patients sometimes run low on eggs or run out of eggs prematurely before they're done with their family building. And so they come and see me, they ask about things they've Googled, for example, something called ovarian rejuvenation. And it sounds amazing. They're
Mm.
rejuvenate the ovaries. Of course, we'd love to do that. Ovarian rejuvenation is where they spin down the blood of the patient and use the plasma. It's called plasma rich protein, and they inject it into the ovaries, thinking to stimulate the stem cells in the ovaries to actually make eggs. And so, if you're running low, well, if you could make your own eggs, which typically is not possible in humans, then that would be great. You can have more eggs to use to get pregnant. Well, this ovarian rejuvenation technique has been studied for 25, 30 years now, and it has not been proven to be beneficial or successful.
Wow.
But it does sound great, and it costs a lot of money. And I tell patients, they come to me and say, this doctor here in Florida, for example, is offering it. How come no one else offers it? And I always say, if only one person's offering this miracle treatment
Mm.
and science doesn't know about it and nobody else is offering it, there's something wrong. Because if it truly was that miracle treatment and it worked, we would all be offering
That is so well said, Dr. Ku. I really love that you said that. It's so true. I think it's so difficult because you're right. And I think we can say that about all of these things, right? I mean, if people say, well, I shouldn't wear mascara anymore and then I'll get pregnant, well,
it.
everybody would stop wearing mascara, right? I mean, that would be
Right.
the answer. So, yeah, this is great information. I really, really appreciate it, and I think this is a really tough time in our history to think about healthcare, and particularly women's healthcare, but healthcare for everyone. I think we're at a really tough turning point, and now more than ever, I think we need ASRM. So I'm so glad that you're there at the helm, helping everyone out and helping us with all of our tech challenges. There's so many, and I'm sure there'll be more as time passes. So thank you for all you do. Is there anything else that we've missed or that we should be covering the patients should know?
I think we've talked a lot of some great thoughts, and I thank you so much for inviting me on to be able to hopefully give out some more information to your audience and your patients so that they can understand, like, it's not game over. Like I said, it's game on, but we have to be very careful about what we read online. I tell my own children that, just because you see it on the internet doesn't mean it's absolutely true. You have to be able to use your brain and decipher, is this really true or not? And if you can't, or if you don't have the ability or don't want to decipher, then ask a licensed professional. They can help you decipher what's real and what's not.
That's great. That's wonderful. Dr. Ku, where could we find you? Speaking of social media, where can we find you online?
Well, you can find me on Instagram and Facebook and LinkedIn. It's an interesting story. My patients call me Dr. Knocked Up because my last name is Ku. Ku is how it's spelled. And so Knocked Up, Ku. It's
Oh
like,
my goodness.
yeah, my patient gave me that nickname and I kept it and I ran with it. So I'm Dr. Knocked Up online. You can find me on Instagram and LinkedIn and Facebook.
Oh, I had no idea. That's hysterical. That's great. Well, we're not going to forget that one.
Good, good, good.
Yeah. So please follow Dr. Ku. Well, thank you so much. I'm so grateful for all you do, Dr. Ku. Really very grateful. And thank you to all of you for coming. Your time is so important. And I really feel that if you are able to subscribe, you will be even happier because you will get all of our information, join our newsletter, join us everywhere you can. You will get this great information. We are here to serve you and give you everything you need to build the family of your dreams. So thanks again for coming, and I look forward to seeing you next week. Thank you for joining me today. I hope this was helpful to you. And if you'd like more personalized support, more information, and more education, you can find it in the show notes under the Building Your Family community. We'd love to see you inside. And if you were interested in today's topic, you will really like this video.